This is an organization that actually Meghna and I worked on it with personally. It's a mid-sized biotech company. And with their therapy, they were trying to encourage patients or help patients get to specialized treatment centers earlier in the course of their disease so that they could be provided with more options at an academic or specialized institution, have better outcomes for those patients, and also hopefully encourage greater adoption of their therapy, which was best in class. The company piloted a solution with us that helped them use real-world claims data to identify referral trends for patients from more of a community setting into that academic or specialized treatment setting. That's something you really wouldn't be able to do at scale even a few years ago on an individual but anonymized patient basis. Being able to say where patients are coming from, if you're looking at from the perspective of those centers that you're targeting, you can see where they're coming from, identify targets. But then once they've actually deployed a field force amongst those community targets, we can measure how effectively those more community-oriented field force is doing at encouraging an increase in the trend of patient referrals earlier in the disease course to those academic specialized centers. This report that we produced with them was used to understand the impact of their Salesforce activity at those critical points in the patient journey. So they were able to, as I said, deploy a field force whose role was to sort of push that top of the funnel. And so it wasn't your traditional sales approach, right? You couldn't measure them exactly on sales because they weren't calling on the targets that actually prescribe. But it still presented an opportunity for you to drive overall sales performance and do it in a way that could be measured so that you knew if your investment was working, if your strategy was paying off. They were able to identify which community sites and providers had the highest referral populations and could spend potentially less time on those providers if they're already achieving the goals that they'd set out, and spend more time on populations of patients or providers that were not quite making that referral journey. They can understand how those are trending over time at a territory, region, and national level, understand the timeline that happened between the referral taking place and the actual visit to the treatment center or one of the many treatment centers available that they were encouraging providers to send patients to. And ultimately, they could also determine what proportion of those referrals would receive the company's therapy. As I said, gives you a really awesome way at the end of the day to still directly measure sales performance and see an increase in sales performance and be able to correlate that back to what had originally been an indirect measure of performance that allows you to take a strategy. Hey, I think we need to push, referrals. I think we need to encourage them and educate the providers in this context that there are these treatment options available, and actually turn that into a tangible, actionable commercial strategy that results in increased sales.